Hey guys, welcome to Rainbow Pagan. Now, this video is called Depression versus Clinical Depression. Now, I didn't think of this before I made this video, but there are two different things. Chemical depression is now called major depressive disorder. And depression is different than that. You may think they're both the same, but they are not. Now, this is my personal story and also education on these two disorders. I am not a doctor nor therapist. Now, depression, I have the definitions below, so I'm going to do it mainly my definition way. Depression is when a person, close to them dies. You're sad, you cry. Something happened to you at school, so you get upset about that, and you're sad for a couple days. Definitions like that. But then it's fine. You're happy after 2 days, or even a day. You're happy the next day. That is what we call depression. Now, major depression disorder, or clinical depression, is totally different. It is something that you deal with all the time. You're constantly depressed. No matter what it is, you're going to be constantly depressed. Now, actually, I have a picture here to show you, if I can do it, of the different brain waves between major depressive and depressive disorder. Okay, guys, here we go. There's the brain wave on depression. And of course you would do that. Sorry about that. This, you can see, major depression is a brain disease. You can look at this, which is linked with depression. When you're a little depressed right here on these lobes. And then you can look at not depression. Yeah, I think this is when it's not depressed. I don't know, I messed up. Depression versus not depression. So I guess this is depression, and that would be not depression. I should have looked into that more. I'm sorry about that. I don't know, maybe you guys can help me out on what you're saying here. Which one is the major depressive? Anyhow, that is you can see a chemical imbalance there and how it looks different. Living with depression, talking about chemical or major depression right now. Living with depression can be hard. It can be a big lack of self-esteem. Not wanting to get out of bed. That things are easy for other people to do. But remember, you can relate to it if you're just depressed, but not have a chemical depression. Well, for chemical depression, again, sorry I'm jumping around, you need medication to control it. Or you can try to do it without medication. I'm not pushing medication. I would try oral stuff before I would do any medication. Because I'm on a lot of medication. It's not good for you. Well, anyhow, depression, you would basically not want to get out of bed, being depressed a couple of days, like I said. But then we got major depressive disorder. Makes you not want to get out of your bed at all. Simple things, simple tasks, like getting out of your bed. See? Like Mickey does. He doesn't get out of his bed. And then another simple thing of even getting out of the bed. And then you go to the bathroom. to brush your teeth. Even this simple stuff is hard to do. You do not brush your teeth. You can get to that point that you don't want to brush your teeth at all. And as you can see in the mirror here, not mentioned before, for me not dealing with my depression and let my depression take over, my teeth are permanently stained. And also, you can gain weight from being depressed. It's called, I forgot what it's exactly called, but comfort food. You get comfort food. So even if you're not hungry, you want to eat. So again, that would be like comfort food. You would just go into the fridge. Let's go into your fridge. See what you have. My fridge is pretty empty. It's in the month. But me, for example, I would probably eat all this in one sitting. Just to give you an example of what it's like. Even a simple task of getting up in the morning and wanting to take your meds, that can be hard too. Cooking can be hard. You're mainly not going to want to cook. You want to go for that junk food. Hold on. Even depression, self-esteem, you may not even want to go outside. That also falls in the category of anxiety disorder, which we covered last night. So anxiety disorder, like I said, falls in so many categories that you can fall into. That is why I don't like to use labels. Because no real doctor, you'll see one doctor about one thing, and then he'll tell you one thing, and then another doctor will say something different. Over the years, for example, I was diagnosed with schizophrenia. You can tell the signs of schizophrenia that I do not have it. And then there was schizoaffective disorder, which is a mixture of schizophrenia and schizoaffective disorder. Bipolar, which you can check that video out. It's an old video, but it's in my People with Disabilities list. All my videos like that will be found in that list. So basically, major depression is extreme lack of self-esteem. If someone calls your name, automatically you believe it. You let that get you down. Your brain's like, this person called me fat, so I must be fat. So some people would eat less, starve themselves. Someone called you fat, you're just like depressed, so you eat comfort food. Those are just a couple of examples. I don't want this video too long. So I hope this video has helped you out a little bit. And I'm sorry the confusion on the TV that I put up. But if you want to check out this video or any other of my videos of depression, they are in the playlist. Alright, see ya. Alright.